Well, Governor Tate Reeves' Medicaid reimbursement reforms have the potential to bring in nearly $700 million from Mississippi's financially struggling hospitals.
12 News senior political correspondent Richard Lake joins us now. And Richard, what exactly is the governor's plans?
Right. Well, it's two changes in how Medicaid currently reimburses Mississippi's hospitals. And it boils down to hospitals would have to pay a higher bed tax. That's going to then fund the state's contribution of Medicaid, which will then draw down federal reimbursements. Now, it's set up between two initiatives. The first sets up direct reimbursement payments to hospitals serving patients in the state Medicaid managed care system. The second covers Medicaid-based payment rates for hospitals by reimbursing inpatient and outpatient fees. It's estimated Mississippi hospitals will have to spend $178 million before receiving federal reimbursements. One of the hospital executives we spoke with regarding this plan is outgoing Mississippi Hospital Association President and CEO Tim Moore. Moore served his last day today as president and CEO after leading the association for a decade. Moore says while he is appreciative of this investment, it leaves out an underserved portion of the population.
One of the key components to this is that this offers nothing to help cover the low wage earners in the state of Mississippi that don't have discretionary income to pay for health care or even to pay for health insurance. So that's where it will fall short in what the state needs. So I appreciate the governor saying that this is just one of many steps. I'm hopeful that the next step will be moving closer to some type of additional or added covered lives.
MHA has not specified why Moore was relieved of his position.
And Richard, how have the hospitals what have they said about this investment and what it will do?
Yeah, they're very appreciative. You know, one hospital executive actually went as far as saying that this is the most significant investment to ever come out of the state division of Medicaid. Now, Dr. Lou Ann Woodward, Vice Chancellor for Health Affairs at UMMC, said, quote, "I am grateful for efforts to ensure hospitals in our state receive funds that adequately reimburse them for the services they provide." An interim CEO of Greenwood LaFleur Hospital, Gary Marchand, said, quote, "Once approved, these programs will reduce or eliminate the underpayments experienced by Greenwood LaFleur Hospital when caring for residents with Medicaid coverage and the uninsured." Meantime, Dave Estorge with St. Dominic Hospital in Jackson had a stellar opinion of the reforms.
This might be the most significant event since that establishment of the agency happened. Whether it's rising labor costs, rising supply costs, challenges in retaining nurses and physicians and recruiting physicians to the area. Honestly, some of us were just kind of wondering, how are we going to get through this? This is not just a lifeline. This is going to allow a lot of hospitals an opportunity to take a deep breath.
This plan must first be approved by the Centers for Medicare and Medicaid Services, and former MHA President Tim Moore believes that approval will come anywhere from 6 to 8 months now, while Estorge is hopeful that it will come from 30 to 45 days from now.